Loose skin under chin after lower lift. It's been about 16 months since my lower, or what my doctor called a subtle facelift, because I didn't have a lot of jowling or loose skin. Unfortunately, I have it now. I had some lipo under my chin, and the scar is pretty jagged, and the loose, bumpy skin is visible from one side of my face. I could tell a week after surgery that something was not right. My surgeon doesn't share my concern. Is there anything that can be done, sort of revision? Steroid injection or a tightening laser?
Thank you for your question. You've submitted your question 16 months after you've had a facelifting procedure where you needed a subtle facelift, and after having it, you've developed these pleats of skin below your chin and, quote, a jagged scar. So I'm going to share with you a little bit of my experience with facelifting, having done facelifting for 20 years. And in recent history, in the mid-2000s, I can share with you things that people like myself learned when short scar facelifts became the thing to do. And that those of us who were doing, quote, more traditional incisional facelifts were, quote, were behind the times. So let's understand why you're in the situation you're in. Most likely, in your initial assessment, it didn't appear like you had a lot of skin. Now, that probably was due to the fact that there was a certain amount of volume in the under chin area. So your surgeon may have concluded that a limited lift with liposculpture would improve your jawline. Most likely, that's probably true, and that your jawline is improved, but yet you now have all of this loose skin. Well, what I learned during that time was that although people see improvement after facelifting surgery, what they want to see is a crisp, nice neck and a beautiful jawline. So even when you do a short scar or limited procedure, very few people are happy with limited results. So invariably what that meant was going back and doing a little bit more extended procedure. So I can probably anticipate that you will need another surgery in order to get the lifting accomplished. Sometimes there's the things that require enhancement are a few factors, and one of which is just simple elasticity and regression. When you do a facelift and the patient is on the table and you see a beautiful jawline, everything feels tight, and you've done your sculpting and tailoring the way you want, you can still, many months later, see some regression, especially in some people who have very elastic skin. So that could be the case with you as well. But regardless of what is the underlying situation, the end result is loose skin underneath. And I would probably recommend that, in my experience, I have benefited in doing more of a vertical lift as a secondary procedure than just pulling back. Very often it's basically a little bit of slide or residual elasticity that's more vertical. And if you look in the mirror and you pull your face upward a little bit and you notice a significant improvement with a little bit of pull, surgically that's usually quite possible to accomplish. So as far as steroid injections and other modalities, if you have loose skin, unless there's scar tissue that is tough, steroid injections will not have much of an improvement when you have to deal with loose skin. So my suggestion is that at this point is coordinate with your original surgeon to have some kind of enhancement procedure, see what you can anticipate, and move forward with something more definitive, and so that you can get the results that you desire. I hope that was helpful, and thank you for your question.